welcome back. Well, if your vision is cloudy or blurry and you can't see well at night, it is possible that you may be developing cataracts. The good news is there's groundbreaking technology that can improve your vision based on your lifestyle. So joining us now to chat about this light adjustable lens is Dr. Nicholas Bruns from Summit Eye Care of Wisconsin. We're excited to have you here.
Thank you for having me.
I was already bending his ear so much during the break because this is so interesting.
Yeah.
So first and foremost, people hear about cataracts all the time.
Sure.
My mom had both her eyes done, and I feel like it's just sort of a rite of passage at some point in life.
Yes.
But what are cataracts, and what are some of the symptoms?
Yeah, so cataracts are something that just happens over time. I mean, you live long enough, you're gonna get cataracts.
So it's inevitable?
It's inevitable.
Okay.
And it happens usually late 50s, early 60s. So we all have a lens inside of our eye, and we're born with it clear. And the lens is what's responsible for focusing light onto your retina, which is the back part of the eye. So over time, that lens starts to develop a little bit of a cloudiness. And so it impacts the efficiency that light is now not able to get to the retina. And so you're left with some kind of cloudy vision, some glary vision, just problems driving at nighttime, those types of symptoms.
So I know when people then get the cataract surgery, like my mom had like a lens implanted, right? Is that kind of what works? So that's a traditional fixed lens, correct?
Correct, yeah, so we take the lens out. There's no fix or reversal of a cataract. All we have to do is cataract surgery, which basically we remove the old lens and we put in a synthetic lens in its place.
Like old lens meaning just what's in your eye naturally?
The natural lens, yes.
Okay, so you remove that, you put in something different.
Correct.
And that was kind of the traditional method. There's this new adjustable, this light adjustable lens. I want to say it right.
Yeah.
So this is something brand new?
Yes, so it was FDA approved in 17, it became commercially available in 2019, and that's when we started doing it. And so the big difference with the light adjustable lens is, I guess backing it up, the traditional method, we were kind of forced to make an educated guess on what power of lens to use.
Yes.
And so we were trying to match the power of the lens to what your lifestyle. Let's say that you don't want to wear glasses for driving, or you don't want to wear glasses for reading. We're trying to use all these numbers and calculations to best educated guess match what you want. And so now with the light adjustable lens, we can actually manipulate the power after it's in your eye to match your lifestyle after you've healed.
What? So does this mean you can manipulate it multiple times or just once?
3 times. You can change it 3 times. So we can manipulate it and change the power, let you live. Let's say you want to be able to drive, but you want a little bit of reading. We can do that, and we can give you a couple weeks to live with that, and you come back, you say, Doc, I love it. Great, we can lock it in. If you say, you know, I need a little more reading, well, we can do that too. So we can do that 3 separate times.
Wow. Okay. So once that happens, then what's the recovery process? What do we need to know about this? Because everyone's going to be like, I want to do this.
Yeah. So surgery itself is very simple. It takes about 7 minutes to do, 7 or 8 minutes. We give you about 3 weeks to heal, and then we do 1 adjustment per week until you're happy with your vision, and then we lock it in.
So how does it work? What are you doing to manipulate the actual way that you see after the surgery?
Yeah, the lens is made of silicone, and embedded in the silicone are they're called macromers, but think of them like building blocks. And so when we're doing these light treatments, we're shining a pattern of UV light onto the lens itself, and these macromers bind together, causing the lens to change shape. So it's non-invasive when we do it. It's quick, it's painless. You just need to be dilated, and you start seeing improvements in your vision as soon as 24 hours.
That's amazing. So you're literally just kind of sitting there like we saw, and you're doing it. So it's not another surgery.
No, it's an in-office procedure. It's painless.
This is amazing. Okay, and so Dr. Mangione, who's coming up, she actually had hers done with you. So I got to bring you up. She's coming up in just a little bit. But so and you can have them both done at the same time, because I know when my mom had it done, she had to wait a couple weeks in between. In this scenario, you can do both at the same time?
Yeah, so traditionally we do one and then the other for a couple of reasons, but one of the reasons is we like to sort of use one eye as a bit of a test. We like to see how close our measurements are, and then if we're off, we can use that to our advantage for the second eye. But with this technology, we're adjusting both eyes anyway, so you can do them on the same day.
So who benefits from this?
Well, I guess the question is really who wouldn't. It's anybody who wants to get out of glasses. And anybody who wants to get out of glasses, we can do this. But really, in particular, we get patients all the time who come in saying, Doc, my LASIK wore off. You know, I had LASIK 20 years ago, and it's not what it used to be. Well, LASIK doesn't really wear off. It just, your eye changes. And you're changing because you're developing a cataract later in life. And so now with this technology, we can get you back to the tack sharp vision that you had when you had your LASIK done. So it's those patients who are really perfect for this, but really anybody's perfect for it if they want out of glasses.
So are you saying that you can do this potentially even if you don't have cataracts yet?
That's correct. Yeah, so we do this often for people who may not be candidates for LASIK. Let's say that your corneas are too thin, or you've got dry eye, or maybe you're outside of the age range for LASIK.
Because what's the age range? Are you telling me?
I mean, no. That's your words, not mine.
I think I am, but
50 to 55, we kind of start leaning towards this route instead, because you can get the same outcome, and it might even be better. It oftentimes is better than what LASIK could do.
Well, yeah, I would think you're kind of helping yourself in so many different ways. Okay, so how does this process work? Because if somebody wants to meet with you, do they just come in and you take a look at their eyes and get a feel for where they're at?
Yeah, so we're truly a team in our clinic. So Dr. Vukic, who couldn't be here because he's actually off lecturing on this right now at a national conference. So we're a true team. So you'll come in, you'll meet Dr. Vukic, you'll meet myself, and we kind of go through the consult process to see if you're a candidate. I mean, not everybody is, but most people are. And then determine if it's something you want to proceed with. And then we schedule surgery shortly after. It's about a 2 to 3 week, period of, just getting scheduled and all the paperwork and all that. And then the process itself takes a month or so to get through.
All right, so there's so many reasons you got to go in and meet with Nick. All right, thank you so much for joining us. This was so fascinating. If you want to know more about these light adjustable lenses and if they're right for you, or you just want more information, give Summit Eye Care of Wisconsin a call. Their number is 414-877-6414. You can also visit their website, which is summitiwi.com.